Good day, folks. Alfie here once again at Vente Pain Relief Clinic. Today we're going to talk about a clinical tip and trick. We're going to talk a bit about something that I call a C7 fascial distortion with T pattern of the upper body. A lot of words. So today is actually my first video in regards to fascia. Fascia is the basis of the work that I do here at Vente Pain Relief Clinic. It's awesome. I love working with fascia. I've seen some great results, and I'm sure many of you who've treated fascia before in the past have noticed that too. So you're going to hear me talk a lot about patterns. So patterns in regards to the way that the fascia is restricted. There's certainly lines, if you want to call them that, like in terms of where the fascia becomes restricted or more restricted. Also patterns in regards to symptoms a person might feel or a clinical presentation. So you can see here, Skelly's all taped up. We're going to discuss this in a little bit. Next week, though, I just want to mention that we're going to do a video that's kind of that's different. We're going to do more of a business practice building video, and the subject is, how do you know you are ready to sit up on your own? Because many of us massage therapists, many of us clinicians, physiotherapists, chiropractors, we're not sure. You know, like we want to, but we're not quite sure. So that's what that video is intended for, and it's going to be on Tuesday at 12 p.m. Eastern. So now let's get back to Skelly here, right? So I've done a tape job on Skelly, as you can see. You'll notice that I've done black tape and then white tape with squiggly lines, squiggly black lines, and this is what I call the T pattern. Right, so C7 fascial distortion with a T pattern of the upper body, and the reason why I call it a T pattern is because it forms a letter T. So look at the thoracic spine down this way, and also horizontally. You'll see for persons like this that these fascial restrictions actually form that type of pattern. So the reason why you see these black pieces of tape around certain sections is that these are areas that are actually, that I've found, that are very, very restricted. That's where the focus of the restrictions are. So for example, C7, posterior deltoid, approximately where the triceps attaches, and also down into the posterior aspect of the forearm here, just maybe about a couple of inches above, superior to like the wrist. Okay, so in this pattern, this is what you're going to see. So this person's going to typically come in and say they've got a lot of muscular tightness. They're going to say that their neck feels sore. They might have tightness of the shoulder, and pure muscular techniques have not really worked for this particular person. Also, you're going to find that a number of these patients are going to be very hypersensitive, and they'll tell you too, like my back is very sensitive to touch. It's very painful when somebody just goes in there fairly lightly. And that's an indication that the fascia could be very, very tight, right? So in terms of the typical clinical presentation the person might come in with, they're going to have that, like I mentioned, chronic tightness of the neck, shoulders, and mid-back. Posterior cervical muscles are as tight as ropes. At least they'll describe it as that. Head, forward posture. They may be prone to stress and anxiety. And I found in general with people that tend to get more fascial restrictions, they tend to be prone to anxiety and stresses. So sometimes what will happen is they'll come in, they'll have a spike in terms of their stresses at work or at home. You'll notice that a lot of their fascia tends to be tighter than usual, right? So also the range of motion of C-spine may be limited, especially rotation. They potentially have done massage before in the past. And one question you're going to ask them is when they're lying prone, because this requires, this type of treatment requires a person lying prone. When you ask them, has anyone ever done these techniques on you when you're doing these while you're doing these techniques, they'll usually answer with a no. No one's really done this, or they'll say that they've done it minimally, and that's an indication that the previous therapists have been more focused on the muscular side of things, when in fact maybe they should have focused more on the fascia. Just remember, like, just because it's myofascial, I know the term, like it basically, like it indicates both, but at times what will happen is that you're going to get more tightness from the muscle, less from the fascia, and sometimes more from the fascia, less from the muscle. You're going to notice these differences. They don't at times go hand in hand in regards to like being equal. In fact, like I was saying, in that when you release the fascia, the muscles will follow. Right? Follow that rule, and you're going to find like a lot of changes in terms of the way that the muscles react. All right, so they might also indicate that they've got this burning sensation around the C7 area, particularly when they have their bad days. They might say it when they come in and tell you. They might have like an episode at the moment, an acute episode where they're feeling so much burning around that section there. And that could indicate that potentially some of the nerves are irritated around that area, giving that burning sensation. So in terms of assessment, you're going to check for cervical spine range of motion, like rotation, extension, all that kind of stuff, like before, during, and after treatment. You're going to check the T-spine segments. In other words, the different segments of the thoracic spine when they're lying posterior. You're going to provide a posterior to anterior directional force, meaning you're going to push towards the table. Again, you're not jamming and trying to adjust somebody. You're just checking to see like how much motion there's of the thoracic spine. There should be about a give of maybe about 1 millimeter or so when you're doing this. A patient, again, might be very hypersensitive in certain sections where the fascia is very tight. Okay, visually you will notice that there's a bit of a bunching up of the tissues. It looks like a round mound that you might find when you're checking the C7 section. As you assess the fascia around C7, you're going to move towards the direction towards the deltoid. You'll notice that the posterior deltoid here, where it's kind of marked in black, is very, very tight. In fact, the entire deltoid might be very, very restricted fascially. And then also, like when you work your way down, you notice like the white tape. Those are areas where it's not as tight on this T formation. So as you work your way inferiorly into the towards the forearm here on the posterior side, you're going to notice that just maybe about an inch, a couple inches above the wrist, like there's a lot of restrictions there. So in regards to like what you're going to do with this particular patient, you're going to have them lying prone, because this is the best way to access these sections here. After you've done all your assessments, you're going to have them lying prone. You're going to basically focus on relaxing the fascia around C7. So this could be skin rolling, this could be any form of fascial techniques. But mind you, the best way to actually go at this is doing techniques that pull. So what I generally do is I go between the upper trapezius, I work my way towards an angle where I'm trying to get at C7 right there. So I'm pulling on this, and just remember, you've got to mention to the patient that this is not going to be the most comfortable thing. Be honest with them, right? Just make sure you tell them also that they can tell you to stop, or let up a bit, because it's not going to be the most comfortable treatment, particularly if the restrictions are very, very, very tight. So you're going to work on C7, relaxing it, trying to get this tissue to move in terms of sequencing. You're going to check every once in a while to see how the posterior cervical muscles are reacting. They should be softening up. Also the interscapular muscles, the thoracic section of the erectors, and also the upper trapezius. They should be softening up slowly. If you find that there's not much give, you're going to go to the deltoid, the posterior deltoid, and you're going to work on treating the fascia around the posterior deltoid / potential attachment for the triceps. And then after that, you're going to work your way down the posterior aspect of the humerus towards that spot that is just superior to the posterior aspect of the wrist there. That's going to be stuck. So these sections are going to be very, very stuck when you work on it, so you could skin roll. I have to add that, this video is more intended for those that have used fascial techniques before. I still invite you to watch because it is very interesting. It could help you, like in terms of your techniques. So once you get here, you're going to go back to C7, but before that, you're going to reassess to see like if there's any changes with the upper trapezius, the posterior cervical area, interscapular, thoracic segments. Checking to see if there's more motion of the thoracic segments. Remember, there should be about 1 millimeter of give. You're going to work again on C7, the fascial restrictions there. It should be less sensitive. There should be less burning, because when you're working on this, initially the person will say, well, it really burns, right? It really burns, it's really painful. You should notice that there's more give with the tissues around C7. You're going to work towards the posterior deltoid again, see how much restrictions there are there, work your way down the arm and into that section of just right above the wrist. Okay, you might do the sequence about 3 times. So from C7, posterior deltoid, to just right above the wrist, C7, posterior deltoid, right above the wrist, so on and so forth. It might take about 3 times, but you should, if you've done your assessment correctly and you've done your interviewing correctly, and your palpation skills are showing that they're having this pattern, you should notice a significant change in terms of the way that the person feels. They're going to feel less sensitive in those areas there when you're touching and when you're treating those areas. Once it relaxes, you can go into more of the muscular techniques. You can actually work deeper because the muscles aren't as tight. When you flip them over onto their back, working supine, you want to assess to see how the range of motion is, particularly through rotation of the cervical spine. You should notice much more give. So if you're doing this correctly, there's a few things to look for. You're going to notice like a total relaxation of the segment here, from the posterior cervical muscles to the upper trapezius, interscapular muscles, the erector muscles around the thoracic spine. Less sensitivity also, that's a significant one you'll notice. More mobility of the fascia. The person will feel more comfortable. But remember, like after this, the person's going to feel quite sore, particularly if it's their first treatment. So this is the C7 fascial distortion with T-pattern of the upper body. Right? So this is what I call it. If you've got questions about this, feel free to email me at vente@ventepainrelief.ca, or you can message me and we can talk about your questions. Just remember also, next week we go into more of a business kind of mode. We go more into practice building. So we're going to talk about how do you know you are ready to start up on your own. So that'll be Tuesday at 12 p.m. Eastern. So watch for that. Anyways, this is Alfie. I'm hoping this helps in terms of your soft tissue techniques. Have yourself a great day. Alfie here again at Vente Pain Relief Clinic. Take care.